Welcome to the journey that is MEDSICON. We are all delighted to have yet another MEDSICON happening this year, which would actually be called MEDSICON 2017, and I'm talking to you while it is still 2016. Now, for a change, unlike August, we'll be doing it in February, which is to make sure that lots of our international delegates and international faculty are able to make to the conference and participate actively. August used to be a period when they would be having their own commitments at their own place, and also the students, on a popular demand and request of students, we've shifted the dates. And we had certainly apologized for not having it in the last 2 years for many reasons, because we are doing other conferences, but we promise that this is going to be yet another outstanding International Medical Students Congress. Now, as organizing chairman of this conference, I've always taken pride in the fact that this is a conference for the students, by the students, and of the students. And unlike any other cultural, social, festival or that kind of an activity which students are involved in, this is a thoroughly academic event with social flavor to it, where the students meet their mentors and the mentees meet other mentees and the mentors meet their mentees. Now, like every year, we will plan to have at least 3 workshops. One which is an outstanding workshop almost every year, and on huge popular demand we have to increase the number of seats. That is basic surgical skill workshop, which would happen like every year and will include the basic skills in surgery, which don't necessarily mean that all those students who are going to become surgeons should be part of it. Everybody has to learn those basic skills as a qualified, competent doctor. And we all know that hands-on training is very limited in our medical colleges. The BSS course would incorporate the basic theatre etiquettes like hand hygiene, preparing yourself for any surgery, instrument handling, suturing, knotting, abdominal incision and closure, bowel anastomosis, bowel perforations, vascular anastomosis. And icing on the cake is the endoscopic or laparoscopic skills that will be incorporated for the first time in the BSS course. This is going to be one such event that you should never miss. Now, we are looking forward to getting the same numbers that we get almost every year. However, we could not accommodate all of them for the BSS course. For BCLS course, which is basically a basic clinical course, we would still be having the same numbers. As always, there's a lot of pressure as to how many can be accommodated. And we are going to have a scientific paper writing workshop, which would be for the first time a hands-on kind of a training workshop. And we are inviting all of you to send your manuscripts on a particular theme that will be circulated to you very soon, so that we can get them reviewed by the eminent reviewers from India and abroad, who will be there to share with you as to what was right or wrong with your blinded manuscript. So you don't worry about writing your name on it, or you don't have to write a name, you can give a quote there. But importantly, you will know what happened to the manuscript. And the 5 best selected manuscripts may find their place into some of the PubMed Index journals, of which I happen to be the editor-in-chief. Now, what I'm suggesting is that you should come forward for this workshop, and especially because scientific paper writing workshops, although they happen, are mostly didactic, and this one is going to be hands-on. And today we know you publish or you perish. Everybody has to publish to exist in this scientific world. So this would be one step in that direction. While we'll teach you as to how you can improve upon what you've done, we'll also appreciate what you've already learned in the process. This workshop on popular demand, and because I personally feel is very, very important for the students, is complimentary, and you're welcome to be actively involved and to push for it, because the vacancies could be limited and we may not be able to push through for all the candidates that are participating. Beyond this, we are going to have, as always, fun and learn sessions, jam session, debates, quiz competition. We're going to have a beautiful, wonderfully conducted some kind of a cultural social activity. And if you do well and we have time, we'll take you out on a wildlife exposure of a kind that you would always remember. Now, why should I invite you all for this MEDSICON? Because like every year, we have a huge pressure for this meeting to be held. And we are not yielding to that pressure. We are simply making you apply that pressure even stronger, because this is something that we all need together. So I look forward to having you all for this conference, and our team, which has a wonderful group of medical students that are very actively and proactively involved in this. They'll be in touch with you through their Facebooks, accounts, through the MEDSICON website, and you will keep on getting those inputs from them. If there are any queries or questions, you're welcome to write to us. I look forward to welcoming you all for this wonderful international event, which is one of its kind, and the first one that started was in 2007 with a slightly different name. We continued with the tradition, and finally we gave it a name in 2011, when every year a new group of students comes forward to take it forward. So we look forward to all of you becoming part of this phenomenon, this journey, and this adventure. So join us for MEDSICON. Send your papers for publication. I forgot about the poster and free paper presentation. But there are many aspects that will be available on the website. We got 300 plus posters last time, and we pick up the 10 best that will be getting the podium. This is to make it look like a really competitive scientific activity. The 10 best posters get awarded, the 10 best papers get awarded, and you must send your posters and papers on something or that you worked on or you look forward to working on. Another unique feature of MEDSICON is send a picture which can say 1,000 words, which is a 3 minutes presentation of a clinical scenario. Any picture on any case, Down syndrome, cleft palate, hydrocephalus, intestinal obstruction, oral cancer, breast cancer, whatever. And we are also planning to have an eminent group of faculty that is coming from UK, especially on Saturday. They'll all interact with you, and we'll try to have a pink ribbon walk if we can manage it, which is dedicated to the breast cancer survivors and breast cancer patients. This Indo-UK friendship group is basically my colleagues and friends who are examiners for the Royal College and who are also involved in teaching the people, the students in UK. We are getting students from UK, from Malaysia, from Indonesia, from Russia, from China, from SAARC countries. They are all going to be participating. So it's a good time to interact with them and to learn from them. Finally, there's one session that is dedicated to counseling regarding your career. So we are getting people who specialize in training for courses in UK, in US, especially the US Assembly and PLAB, etc. So they'll guide you into picking up a career. The world is becoming a global village and people travel to places to learn. There's no harm in learning about it while you're sitting right at your home. So welcome to MEDSICON. God bless you. All the very best.